Alrighty. Okay, so when we're talking about our immunologic memory, right, we have to talk about active and passive immunity. Okay, and so active immunity is going to be when you have a direct encounter with a specific pathogen. Okay, so this could be if you get the common cold, all right, or all right if you get a vaccine. So it's either going to be one or the other: direct encounter with the pathogen, so you can have a direct exposure to the antigen, like say someone coughed in your face that had coronavirus and you inhaled it, or if you get the coronavirus vaccine, all right, you will then have a direct exposure to the pathogen. The whole point, though, is memory cells. Memory cells. We want to get memory cells when we talk about immunity. Okay? Now, with passive immunity, this is when you get, all right, an immunity from another individual. Could be human, could be animal. Okay? We see, for example, all right, in babies that are nursing, all right, if mom is nursing, she will confer or transfer some of her antibodies over to the baby through her breast milk. Okay, and also we see it with some types of blood transfusions or antibodies from snake bite venom. Okay. So problem is with passive immunity is that you don't get memory cells, okay? So it only lasts as long, all right, as the life of the antibody is going to be. Once those antibodies go away, all right, then that immunity goes away, okay? It will not stimulate the proliferation, okay, of the memory cells. Okay, so keep that in mind.
So, in passive immunity would be getting plasma.
Yeah, because plasma is conferring or transferring the immunoglobulins, the antibodies, in the blood plasma. Yeah, so once they go away, then you're done, unfortunately. Okay, so let's finally talk about vaccinations. Okay. Most of us here pretty much understand, all right, that vaccinations are going to help stimulate, all right, the production and development of memory B lymphocytes, all right. So when we get a vaccination, it's either going to be what we call an attenuated or weakened version, all right, of the microorganism, or it's just going to be dead, okay. And it can be parts of the microorganism. The antigens, that's all you need. You need to get the antigens, all right? So those foreign proteins or polysaccharides into your body somehow so you can then, all right, have your immune complex cells, the cell-mediated and humoral immunity components, all right, be exposed for that initial exposure, because then you go through that process of the initial exposure, antigen detection, then activation of our lymphocytes, then proliferation of the lymphocytes, and then differentiation of the lymphocytes and production of antibodies. Okay, that's what we're looking for. All right, obviously, then the second exposure, then we will have a much shorter response time. All right, everything will be shorter. The lag time will be shorter. The antibody production time will be shorter. And not only will it be shorter, it will be that much more expansive. It'll be that much larger, okay? So when we're dealing with vaccinations, we are, all right, depending on the humoral branch or humoral immunity of the adaptive immunity, which, remember, our immune system, the two branches, I think I have, all right, well, I don't have it there. The two branches or the two parts of the immune system, innate immunity and adaptive immunity. Okay, and then we break down the adaptive immunity into cell-mediated immunity and humoral immunity. Cell-mediated is primarily going to be the T lymphocytes, and then the humoral will be our B lymphocytes. Okay. All right, and some of these vaccinations will stay with us for the rest of our lives, and some will require booster shots, all right, every once in a while. Okay, so now we're going to talk about our hypersensitivity reactions, allergies and such, okay? So these type of situations, all right, is when our immune system is working too good or we get an exaggerated response, all right, when the immune system is reacting to an antigen, okay? So there's three different types, all right, when we're talking about time-wise. The acute hypersensitivity occurs within moments or seconds. Subacute, all right, will be within hours, 1 to 3 hours. And then delayed can be 1 to 3 days, okay? The first two, acute and subacute, are pretty much going to involve B cells, okay? Delayed hypersensitivities are primarily going to involve T cells, okay? So T cells for delayed, and then B cells, okay, for the acute and the subacute, okay? All right, so I don't want you to think of a hypersensitivity as when the immune system isn't working, all right? It's not diminished, all right? In fact, it's just working too good, or it's having just some sort of really quirky or strange response to the antigen, okay? So the acute hypersensitivity reaction, all right, this is what pretty much I would say 85% of people that live in Greenville get to experience in the spring and the fall. All right, when they're exposed to, all right, a non-infectious substance, all right, that is going to trigger a response in the immune system, we refer to them as allergens. There's all sorts of types. In fact, oh, it's not listed up here. Cats is another one, all right. Mold, all these, all right. So a lot of these things, again, they're, yeah, with the cats, I found that out, and with dogs too. I found it out. You know, there's no such thing, by the way, as a hypoallergenic dog. Okay, just want to put that out there for those of you that are like, oh, I bought this one dog years ago. It was a Yorkie poo, and I fell in love with it. He's a 14-year-old dog right now. Lives with my dad. My dad stole him from me. I won't get into that. But he was advertised as being hypoallergenic. And so I'm thinking, all right, cool. At the time, I didn't realize I was allergic to dogs. But I found out with my current dog that I am allergic to dogs because when she licks herself, and if I'm playing with her or wrestling with her, any part of my skin, usually in my hands or arms, not my hands, my arms, that makes contact to the area of her fur that she can lick, I get red. Not bad, you know, just a little bit red. So I start to get hives. All right, but it's not so bad where my skin starts to welt up. But point being is, with the other dog, I never got that. But then I started reading articles about hypoallergenic, and that's not true. All right, they just produce less allergens. Okay, but you're right, it is in the saliva. I found that out. Okay, so what we're going to see here with our hypersensitivity reaction, all right, is we're going to see, all right, some of the symptoms. Just go through what you might have during hay fever season if you are a person with allergies, all right? Watery, runny nose, all right? Someone like myself, because I do have allergic asthma, okay? Labored breathing because of the bronchoconstriction, all right, of some of the tertiary bronchioles, all right, and the smaller bronchioles. Not so much coughing. When it gets pretty bad, you can have symptoms like vomiting and diarrhea. And then I know that some of us have heard about anaphylactic shock. All right, that's when you get pretty bad, widespread systemic vasodilation and inflammation to the point where it just drops your blood pressure so much. All right, and you have excessive inflammation and swelling where you can literally close up your bronchioles to where there's virtually no lumen there, making it very difficult to breathe, okay? All right, and then we have AIDS here. So we talked about hypersensitivity reactions in which the immune system is kicking butt, it's doing way more than it should. It's an exaggerated response. What happens now when our immune system becomes deficient, okay? And the virus that is responsible for that is the human immunodeficiency virus, HIV, okay? And here's what it does. Kills these guys, the helper T cells. And you saw the role that the helper T cells do. Again, they get the other cells to do the heavy lifting. So they're the ones that are kind of like the supervisor saying, all right, you do this, and you do this. So now we're taking them out of action. So that means we can't activate B cells effectively in some situations because you know the T cells help to activate B cells. All right, we have difficulty activating some of our non-specific cells like the macrophages, all right, our natural killer cells, and our cytotoxic T cells. Now, the cytotoxic T cells can still operate on their own because they can respond to the MHC class 1 receptor issues. Okay, so they can still go along and on the immune surveillance and come across an infected cell or a damaged cell, unhealthy cell, and still have a response with the CD8 cell. Okay, but it's your immune system is really handicapped when you are without or you have a significant decrease in the CD4 helper T cells. Okay. So HIV is transmitted usually through intercourse, needle sharing, intravenous needle, and then we've also found out that through breastfeeding here. Okay. So it's not until, all right, your helper T cell count falls below 200 cells per cubic milliliter are in the blood. Okay. So at that point, if it's higher than that, if it's like 300, 400, then you're still HIV positive. All right, you're not really full-blown, what they call full-blown AIDS or AIDS until you have this specific diagnosis or lab result. All right, when you're below 200 cells. Okay, and for the most part, it's not the virus the HIV virus that will kill you. It's these opportunistic infections. There's a cancer that prior to AIDS was very rare. It's called Kaposi's sarcoma. All right, and you never heard of it, and these people, one of the first visible signs and symptoms are they've got these boils on their skin, and so they're just not there. And so when that started popping up in the HIV positive population, they're like, there's something going on here. There's something wrong. So that's usually what will happen. You'll get opportunistic infections like pneumonia, any of those types of stuff that, you know, people with fully functioning immune systems would not have a problem fighting. All right, HIV positive or AIDS patients have a hard time. Okay, so we found that a good way to cut down on infection with AIDS is just practice safer sex, don't needle share, all right, and just practice preventative measures.
So how would like practice like, does it help with the T lymphocyte numbers or something?
Wait, when you say what? Say that again.
PrEP and PEP. So like you take before or like if you tested positive, you can get after exposure.
Oh, is this that drug?
Yeah.
I've seen it advertised. I have to look into the mechanism of action of the drug to really be able to.
I know I've heard about
Yeah,
it, but I didn't know how it works.
Yep, it's interesting you say that because. Did you? Yeah.
We talked about it briefly.
I don't know enough about how that drug works, so I can't.
Early, right? Yeah, you can take it early, like, or
right. Because what will happen, and that probably has to do with the virus titer, like that if you actually get infected, that it's so low that your immune system can respond to it. I'm speculating because when I saw the commercial, I'm like, well, how the heck does it do that? Because who is it? Magic Johnson. And it was assumed, now he went through a regimen, and I think they detected his HIV early enough where they were able to decrease his viral load almost to the point where they were able to, that was the theory. Again, I don't know enough about it. From what I recall, his viral load wasn't very high, so they were able to reduce it and then pretty much eradicate the virus. And a lot of times, if it doesn't really go detected, and then the viral load gets pretty high, then it's almost impossible to eradicate it completely, because this virus, again, and when you get into micro, have you gotten to the virology yet in micro?
I've already taken it.
Oh, okay, all right.
It was just like a year ago.
Oh, okay, all right, yeah. I mean, certain viruses are amazing in the fact that they can hide out in cells, and I won't say they'll go dormant, but they can hide out in cells, and they can, and whereas remember we talked about the plasma membranes will have just those receptors, and some viruses when they infect the cell, they start putting these abnormal receptors out. And that's like they're putting flags out. So the immune cells come along like, oh, that's easy. That's an unhealthy cell. We'll kill it. Some viruses don't do that, and they'll just hide out in there, and so you can't see. And so while it's hiding out, guess what it's doing? It's making more virus. And then eventually it makes so much the cell, I won't say it literally explodes, but it explodes and the viruses pour out. And they go and find other cells. And so it's one of those things where some viruses can escape detection. And when they escape detection, that's when the viral load can increase. And if it gets too high, then your body, unless it has help. And in this case, you've got a virus that's destroying literally the helper T cells, the cells that help out in the immune response. So that's where I think, and again, I wish I knew more about the drug. I have to look up the mechanism of action for it and see. But that's what I'm speculating. Okay, great question. Let's